Hi, I'm Dr. Goel. I'm a general neurologist. Welcome to my channel. Through this channel, I attempt to explain neurological conditions in simple language. Today, we are going to be talking about insomnia. And this video, I specifically wanted to talk about things that we can do naturally to help with sleep at night. A lot of my patients report to me that they have trouble with sleeping. They might be coming to my office for headaches or back pain or neck pain or worsened neuropathy pain, but majority of them will also report trouble with sleeping when I specifically ask them. And it is so important to sleep well because sleep is the best medicine for our body and for our brain, for our physical as well as for our mental and emotional health. And hence, I'm a big proponent of sleep. I myself struggled with sleeping for a year or two, and I tried to educate myself of what could I do to help with this other than using medications. And I didn't want to use medications for reasons you might understand. And that is my theory, even in practice, that I try to avoid the use of medications as much as possible. And I always talk about supplements or other natural ways of doing things. Of course, supplements are not as miraculous in terms of having an effect, and sometimes natural ways of doing things includes hard work. It involves hard work and changing lifestyle, and sometimes it's hard for patients to do them. However, I think it's important to have the knowledge of them, because then you might be able to see how you could incorporate those in your lifestyle. So without further ado, let's get talking. So what I like to tell is that our day and night are very, very intricately connected, which means what we do during our daytime affects when we go to bed at night and how well we sleep at night. That's a good thing, because that means that maybe we can make certain changes during our day to help with sleep at night. And hence, we actually have a lot of control on our sleep than we think that we do. One of the most important things is early morning light exposure. And when I say early morning light exposure, it's outdoor light exposure, out in the open, where you could step outside your house and get exposed to the natural ambient light, sunlight. Don't have to look at the sun, that's damaging to your eyes, but just be out there and let your eyes get all that ambient light. When that happens, though, that ambient light goes through your eyes to a certain part of the brain, and it sends signals to every single cell of the body. Hey, it's time to wake up and it's time to get moving. When you do that, it also sets another internal alarm clock for you of some sorts, where 12 to 14 hours from then, there will be another signal to all the cells in the body that, hey, it's time to relax. It's the end of the day. So there's sort of an internal clock mechanism that works when you get exposed to the natural light in the morning when you first wake up. Ideally, within an hour of waking up is the best time. So if you're waking up at 5, by 6, try to step outside, even if it's just for 10-15 minutes. That may be good enough. If you drink coffee, maybe step out and sit on your porch and drink your coffee. I also tell patients that if you could take a walk instead, that's wonderful, because then you are not only getting the natural light, but also you're getting some exercise along with it, which is always very good for the brain and for your body. So that's the most important thing. That's a mechanism that's very, very intact. Even in animals, they sleep at sunset, they wake up with sunrise, they are outside. So that natural light exposure mechanism is very, very primitive, and it's very effective. The second thing that I tell my patients is, if you drink coffee or tea or any other stimulant of any sort, do not take it after 11 a.m. Because when you do that, you are affecting your sleep at night, because the brain is not going to be able to relax. It's not going to be able to get freed up of the stimulant effect. And so when we drink, a lot of times what happens is people who have difficulty sleeping at night, and they feel tired and foggy in the morning or during the day, they have even more coffee or even more tea or other stimulants, and it becomes like a vicious cycle. More coffee, more tea, more stimulants, and then less sleep at night. And then of course the next day you're again tired and fatigued, and you take more of the stimulants, right? So you want to try to break that cycle somehow intentionally and work on that. The next thing, and again, I'm going in order from like morning to evening, but no screen time after 7 p.m. or so. And 7 p.m. is I'm just giving a rule of thumb, but for some people it might be 8, others could do 7, but see what you can do. The idea is, when you are exposed to any sort of screen, whether it's computer screen, your TV, or your phone, if you're looking on the phone, watching stuff, or on social media, all of that again has this blue light in it that pushes your sleep out. It disrupts the quality of your sleep when you do fall asleep. So it is something that I always recommend that try to be more intentional about in the evening, and try not to do it, not to expose yourself to blue light. And it's very important, especially if you're having difficulty with sleep, to be intentional about it. No alcohol in the evenings, because alcohol is a big sleep disruptor. A lot of my patients tell me, Dr. Goel, I take alcohol to help relax, and I feel like it helps me sleep. Studies have shown that people who take alcohol and then fall asleep, they have a lot more micro awakenings during the night. Their sleep is much less restful compared to some people who fall asleep without alcohol. No overhead lights. So the ceiling lights that we have, the recessed ceiling lights, and the ceiling lights, the angle at which they hit our eyes, they push our sleep out. Of course we need light at night, so typically I would recommend that you use lamp lights or floor lamps, because they're at a lower level, and so they do not hit your eyes at the same angle as the ceiling lights do, and they do not stimulate certain areas of the brain, and which would push your sleep out. So instead of using ceiling lights in the evenings, try to turn them off in your bedroom or in your living room, and use lamp lights or table or floor lamps instead. Having a nighttime routine is very, very helpful. And when I say a nighttime routine, it's like a 4 or 5 step routine that you do right before you go to bed. So for example, it could be brushing your teeth, washing your face, washing your feet, taking a shower, putting your night clothes on. But whatever it is, those 3 or 4 or 5 things, you do it and then you go to bed right away. You do not start doing something else in the middle, because then it's not your nighttime routine. Okay, you do those 4 or 5 things and you go to bed. When you do this consistently for a few weeks, your brain will start associating these activities with sleep, with relaxation, and it'll be much easier for you to calm down and relax. Even if you are wired from the activities or your incidents during the day, if you get into this routine and if you do these 4 or 5 steps and your brain will start relaxing because it knows that this means that it's time to relax, it's time to go to bed. And hence I always recommend having this routine and taking advantage of this knowledge that this is how your brain works, right? And then have a fixed bedtime. Having a fixed bedtime is the same idea, that your brain gets used to to a timing, that at this time I start falling asleep. It's time to call it a day and just relax. And that's what we do for babies, don't we? We have a night routine for them. We, when they're first born, they don't have a circadian rhythm. They are, sleeping and waking up at all hours of the day and night. So we try to put them in a routine. We, feed them, shower them, massage them, and then, put them in bed at a certain time in the evening, and that becomes their bedtime, that becomes their evening routine time, and that sort of helps with setting up their circadian rhythm, right? So we got to take advantage. We know all of these things. We just need to put them into action and see how we can put them into action. Again, I really hope that if you're having trouble with sleep, you will try some of these steps, and also try to see as to what is, you may already be doing some of these, but there might be others that you aren't, and that might be the broken link in the chain. So I would recommend that you optimize your broken links, and see if you can optimize your sleep without the use of medications and by incorporating these healthy habits. I hope you enjoyed this video and this was helpful. Please stay tuned, and I would love to see you in my other videos. Thank you.